So let's talk about blepharitis. Blepharitis is something that a lot of patients come to us eye doctors with. And you may have heard that from your optician or another eye specialist, or you may have had different symptoms ongoing for some time and you get told at the eye appointment for the first time that this is what you have. But essentially blepharitis is a big problem and it affects a lot of people. What is blepharitis? Well, our eyelids have lots of glands that make the different components for the tear film, because the tear film is actually, it's not just watery substance, there's a lot of components to it. There are obviously salts and antibacterial agents, there is mucus and there's lipids as well as the watery component, and all of those bits need to be in perfect balance for the tear film to be healthy. And the tear film forms part of the focusing mechanism of the eye, so it's the first layer of the eye that light encounters when it enters the eye, and so problems with the tear film can affect your vision. So blepharitis is essentially where one of the types of glands in the eyelid, called the meibomian glands, is a bit overactive. It's sort of, you get a bit of too much lipid production, a bit too much stickiness, and it's kind of like a skin type, kind of like having oily skin, but just in the eyelids. There is sometimes an association with a general body condition called rosacea, but not always, not in the majority of cases. So when we look at the eyelids, we can see this buildup of oily substance on the edges of the lids, and sometimes you see the little glands being capped and plugged with oil. That we can see the tear film can be quite oily sometimes. This also leads to low-grade inflammation of the eyelids, because that oily environment is a really enticing environment for bacteria, normal skin bacteria that live on our skin all the time, but they overgrow in this sticky environment, and that can cause irritation from all the byproducts of them living there, irritation to the eyelids and this low-grade inflammation. And so with all this stickiness encrusting in the base of the lashes and the edges of the lids, you can also develop a dry eye as a consequence, or your dry eye can worsen from the blepharitis. What do we do about it? So when we notice it, so the first thing to recommend is good eyelid hygiene techniques. Literally, we need to physically remove the stickiness from the eyelids. So sometimes we advise a warm compress, which helps to melt the stickiness. And after that, you use lid wipes or cotton buds just to carefully remove that stickiness from the lid margins, morning and night, which kind of balances and regulates the skin environment. And often it's also helpful to use some lubricating drops to help with the dry eye side effect. Now, this regime, this routine, it needs to be ongoing, because if you stop doing the lid hygiene, if you stop doing the lubricants, what you might find is your symptoms get worse again. So things like grittiness, burning, tired eyes, itching of the eyelids, all of these can be blepharitis symptoms. If you get an exacerbation of the inflammation, so if your symptoms are getting worse and you're doing the lid hygiene, sometimes it means the inflammation is just a bit too much, and we can run a course of steroid drops, anti-inflammatories, to calm it down, get it back under control, so your lid hygiene can have the opportunity to have a good effect for you again.